Be Confident Coaching Center. The courses offered are IELTS, OET, UKVI IELTS and Communicative English. Online, offline as well as crash courses are being provided. If you wish to join, please do contact me at the given number. Today, I am going to take classes for OET exam introspection of 28th May 2022. So I am going 45 minutes is being given for the writing task, of which 5 minutes you will have to make notes in your mind itself because you cannot make use of your pen or pencil. Before beginning the task, you will have to go through the writing task just to ascertain what type of letter it is and to whom you are writing. Thereafter, you will have to mark the important points that need to be included in the letter. In this particular letter, this is a replica of the original letter dated 28th May 2022. Today's date is being given 8/1/2022. Patient's detail, name McCarthy. Her age 86. Address is being given, which is same as the address being provided in the writing task. Now the social history is being given, and that is not important while we are writing a noun case. Now let's move on to the medical history. Medical history 2016, osteoporosis. 26 December 2021, the patient had a fall followed by a food jammed under the table in the rehabilitation home, and medical history and social history should not be mentioned in the noun case. She was diagnosed compound fracture of the tibia of the left ankle. During hospitalization, she underwent a fixation surgery with 8 screws and 1 metal plate were inserted and is covered by a plaster cast. Her assessment showed that her condition was conservatively managed and her recovery well, and now she is fit for discharge. So she is recovering well. Now she is ready for the discharge back to the community health center. Now, post-operative. This has to be included while you're writing the non-case letters. She developed a hospital-acquired pneumonia. Saturation decreased, respiratory rate increased, cough, dyspnea and tachycardia. However, everything was managed conservatively. Increased respiratory rate, heart rate, reduced oxygen level, but that was conservatively managed. All these symptoms shows that she had pneumonia. Her present condition, currently depressed, increased weakness, managed by fluid intake. And the investigation shows that inflammation is normal. In the discharge plan, it has been stated that codeine medication 8 mg for 4 days has to be given. Check for plaster cast. Inform doctor if she has got symptoms like discoloration, pain, redness, tingling or numbness. After 6 weeks, review plaster removal and also keep the cast area dry. Patient weak, encourage food and fluid intake. Engage family. Depression, her mood could be stabilized by the intervention of her family. Leg elevation and pressure care should be provided to her. Attend OPD for 6 weeks till cast has been removed. And assist in daily activities. And check for physiotherapy. And it has to be continued because she had pneumonia. So to manage her condition, she has to have chest physiotherapy. The writing task is being given. In the writing task, using the information in the case note, write a letter to the community health center and the address is being provided. Here the patient's address as well as the address to whom it has to be written are the same. So this will help you to recognize whether it's a noun case or an unknown case. Now let's move to the letter. Answer. The date has been mentioned. The charge nurse, community health center. The address has been mentioned. Dear sir or madam. Reference. In the first paragraph itself, you will have to state the purpose of the letter as well as the diagnosis. So I have mentioned here. The purpose of writing this letter is to update the present health status of Mrs. McCarthy, who requires ongoing care and management. This is the purpose of the letter. She is recovering from fixation surgery and hospital-acquired pneumonia. She is being discharged back to your care today. So she is being discharged back to your care today because she has been brought here from the community health center. Now after her treatment, she is being discharged back to the community health center. Second paragraph. During hospitalization, so we need not mention about the social history or the medical history because that is being known by the community health nurse. During hospitalization, Mrs. McCarthy's medical intervention for restoration of compound tibia fracture of the left ankle was performed successfully through fixation surgery. However, Mrs. McCarthy's weakness and fatigue during hospital stay were managed with inclined fluid intake and is advised to continue the same even after discharge. So she has to continue the same even after her discharge because she is dehydrated. Okay, so now let's move to the next clip. Now the body paragraph second. Post-operative, she developed hospital-acquired pneumonia, which was conservatively managed. Although chest physiotherapy has been initiated, it needs to be continued. She is on codeine 8 mg and amoxicillin, which has to be continued for the next 4 days. She has made a good recovery and is fit for discharge today. Now comes the recommendation paragraph. It would be appreciated if you could provide continuous care and management. Kindly provide care for her plaster cast, which needs to be kept dry, and monitor the pressure area. Assist her in activities of daily living. It is important to monitor her pain level. Please note she has a follow-up at the clinic after 6 weeks to remove her plaster cast. Kindly administer codeine 4 tablets daily. It is worthy to note that the investigations on her vitals and inflammation marked normal except her heart rate. Now the last sentence. Please do not hesitate to contact me if you have any queries. So this is the letter. This is the answer of the letter. I believe it was very easy for some students. However, some students really faced difficulty because community health nurse was given. But you should ascertain whether the address of the patient as well as the community health center is same. If so, then it would be a non-case. Thanks for watching. Please do share your comments. If you like my video, do not forget to like, share and subscribe. Thank you for now.